open up my video. There we go. So hopefully many of you can see me. And so let's see here. All right. So thank you for everyone that has joined us today. I wanted to, and let me see. So the wonderful thing about doing a webinar is that, especially one on telehealth, is that all of us are sitting here actually experiencing exactly what we're working to improve on ourselves. And so as I'm sitting here going, okay, I'm now telecommunicating with all of you, I'm looking at my picture and going, why do I have this glare in my face? You know, and I'm considering this, and I know, you know, there are wonderful memes and all sorts of videos out there where we now have many very humorous things of, you know, people who are, you can only see their forehead, you know, people are too close, too far. And so as we're starting to think about just the topic we're talking about today, I want to kind of reflect on even how you are consuming this service. And let me see if I can get rid of that little line in my face here. There we go. That work? Awesome. All right. Because even our experience of receiving webinars really is important as we consider our perception of telehealth and how we go forward in sharing telehealth with our clients and our patients. So a little bit about me. So my name is Michelle Evans. I have a doctorate in social work. I'm a licensed clinical social worker in the Chicagoland area. I'm currently a hospital administrator for a state hospital. Additionally, I've spent the majority of my career working with the Latino population as a bilingual therapist. And I do the majority of my work working with individuals with sexual addictions, drug addictions, and severe mental health disorders. I've worked in higher ed as an administrator, and I've been teaching for about a decade here. And so talking about these particular topics is one of the ways that I continue to learn. And I know I've been really encouraged over the last couple of months, just as we've started to return to our homes and receive the world via internet, via telehealth. And because it's really, in one hand, on the good side, given me an opportunity to really expand my perspective. Normally, when I go to trainings, I in particular enjoy going to in-person ones where I can interact with the speaker, where I can talk to the people sitting at my table. However, that means usually I attend CEUs that are in my community, provided by individuals in my community. As we look at telehealth, that's really given me an opportunity to expand my horizons, you know, especially when we look at organizations such as the MHTTCs, and they are nationwide, and they're really providing wonderful content and bringing in experts that are really sharing things that are happening in different parts of the nation and helping us become more informed. And so thinking about that and really reflecting about how I am a consumer of telehealth, internet communication, whether it's training, whether it's other, you know, doctor's appointments and things like that, I think that is very, very important to kind of take a moment just to think about your perception of this. When you start thinking about attending a webinar such as this, or you start thinking about you're going to connect with your doctor via telehealth, what are some of the questions and concerns that come up in your mind that are important to you, are things that are important for you to know? Because just as with culture, our telehealth services are received within a culture. Many of us, if you're a clinician, you most likely have an advanced degrees, and so you're relatively used to working within the internet. And so therefore for me, because every single day I use email, I use the internet in some way. When I think about connecting with my doctor via telehealth, I understand that there are ways to ensure that it's secure. I understand maybe some of the expectations that my doctor might have. In other words, I don't do it in the middle of a Starbucks if I'm having a medical consult. And these are things that I have the privilege of understanding as someone who works within the internet every single day. However, as I look at some of my family and friends who maybe don't work within, you know, the internet world as much as I do, they do have significant questions about this. And this is something that as we think about working with our clients, something to think about. because again, as we approach our clients with our own privilege of education, of experience with the internet, they may be in a different place. And so recognizing our own comfort level or uncomfort level, there are certainly clients that are more comfortable with it than I am. Texting, for instance, and, use of certain apps. As we think about that, that's going to help us really provide services and understand the situation from a holistic way. All right, so let me take a look. Here's what I'm planning to talk about today. All right, learning objectives. Hopefully, by the end of this webinar, you will be able to describe how cultural factors impact the experience of receiving services for the Latino population. With everything I talk about, I'm talking about norms. And so there's a lot of literature just on norms, but of course, any single person that we are working with can be very, very different based on their experiences, where they grew up in the world, and what they've gone through. And so even though many of the statements I make will say the Latino population, it's so hard to generalize any specific person. And so these are just guidelines, things to think about, not necessarily diagnostic as to individuals that we're working with. Describe the benefits and challenges of telehealth, which I know we're all aware of, but I'll pull those apart a little more. Identify cultural ways of expressing distress. Apply effective communication techniques while using telehealth modalities. And so hopefully during this webinar, I'll be able to give you just some ideas as to good ways to make use of this resource. I want to mention that some of you have great resources that perhaps even sitting here now, you'd like to share. We have a Q&A, and I know it's supposed to be for questions and answers, but often if you have other ideas, throw them in. And that way, either A, I can read them off, other people can see them, but often sharing those resources can be very, very helpful. And so at the end of this webinar, we'll be looking at those questions and answers. And certainly if you put something in there, I can certainly read it off just to make sure that we all get that opportunity to see that. All right. So here we go. How cultural factors impact the experience of receiving services for this population. All right, so I want to back up a little bit and kind of talk about the elephant in the room, which is, why are we talking about telehealth today? I work with many students who are in practicums for their Masters of Social Work program, and many of them are now sitting in this world where they were in their practicum, seeing clients face to face, and now are at home. These are individuals who rarely had experience working one-on-one. And so the interesting thing is that as they started looking at, how do I learn about telehealth? 6 months ago, there was very, very little. There was some, but very little on learning how to provide telehealth. I know even when working with some of my own colleagues, there was a lot of suspicion as to, can telehealth actually provide a good service? Is it helpful? Are there certain populations that shouldn't be offered telehealth? A lot of these questions which there wasn't a lot of education on. All of a sudden, and I hear this from my students as well, the amount of education on this has just exploded. We're seeing a lot more just on telehealth. Now, this is some of the impact of the crisis. It's our own response to looking at, what do we need to do in terms of this COVID outbreak. And so as we're thinking about this, we have to recognize that telehealth, just like any modality, whether it's in person, whether it's groups, individuals, it is provided within a context. And so telehealth within a crisis is different than telehealth on a regular day. Because all of our work, especially clinical work, is done within the context of everything that's going on in the world, and even in our own offices and in our own lives. And so some things to note, just as we're talking about this context that we're offering telehealth services within. The impact of a health crisis may include home or environmental stressors, school or work stressors, social or emotional stressors, isolation or loneliness, mood dysregulation, reduction in the ability to use coping skills or self-soothe successfully, exacerbations of factors of oppression and discrimination. And so I know the world that we're living in now is even changing day by day. As we enter into other crises, we're looking at our clients being in a different place. And so as they're approaching services, one thing I've noted that I had several clients initially when we started offering telehealth services in my own private practice who weren't comfortable with it. They're like, well, we'll just see what happens. Maybe we'll go without a session for a couple weeks and, see if things change. As time goes on, I've found that many of the clients that are approaching that say, you know what, I need to come back, they're in more stress than normal. In other words, typically our sessions were maintenance sessions, and now we see them coming back. Perhaps they're trying to avoid telehealth in some way, and we see them coming back in what I'll say is worse condition. In other words, having more stressors, not feeling as well, almost an emergency session because of what's going on in our changing world and a lot of the safety concerns that they're experiencing. And so as we think about the impact of the crisis and how that impacts telehealth specifically, this is one of the benefits is the ability to be able to offer it immediately in a crisis situation like this. It works very well for this. And so, however, the clients that we're working with, they're more complex. And so even though I might be able to reach out to you more easily, okay, let's, we can have a session, even though maybe I'm at my house or I'm at a different office. Yep, I got time in 30 minutes. We can do that. But the client that we're now interacting with is experiencing a lot more stressors, which and I know in my own mind, sometimes when I'm preparing for my own session, and I'm preparing, okay, well, what did we do last time? And what might we talk about today? And, what are some goals that I have for the session? Often our clients are walking into the telehealth session with so many stressors that they're not able to work on the goals that normally we've set. In working and doing some supervision with some individuals in therapy, I found that many of the goals have just kind of gone out the window because of these significant stressors that our clients are currently facing. Of course, we have just the stressors of a pandemic, which might include frustration, boredom, or anxiety related to social isolation. I find many of my sessions, I run some group sessions for some adolescents, and the majority of the session, I think, there's been great attendance, first of all, because no one has any excuses. However, when they are participating, it's everybody wanted to come, however, at the same time, they're unfocused, they're watching other things, it's very hard to get them to work on one particular topic. There's inadequate supplies, access to regular medical care, food, clothes, masks, and medication, fears about becoming infected or infecting others, financial loss, and stigma from others. And so especially when we're talking about already stigmatized populations, and now we're looking at this additional pandemic, a lot of the issues that our clients are dealing with are re-traumatizing many of the things that they've dealt with before and are disparately infecting many of our vulnerable populations. I know at the beginning of this, many of my clients did not have access to computers. I still have some individuals who are doing their sessions via phone because of lack of access to technology. And research shows that the Latino population is most likely to be impacted by the technological divide, not have access to technology, work in jobs that are more likely to not allow working at home, where they have to go into their workplace. And that's provided a significant amount of stress to especially my adolescent clients who are not necessarily information literate. They're going on to Facebook and social media and getting information on the pandemic and things that are going on in the world, and coming to session with a lot of questions that their parents can't necessarily answer either. And so we're spending a lot of time either trying to focus us or also talking about what exactly is going on and how they can keep themselves safe and how to deal with many of those stressors that they're suffering from. And this is some of the disparate impact of COVID-19, especially in this world that we're in. I'm in the Chicagoland area. We see that the Latino population is more likely to have a lower socioeconomic status, less access, and like I mentioned, more likely to work in the gig economy. And so I work with sexual addictions. I tend to work more commonly with men. And so my adolescent boys typically have single mothers at home who don't have work. And so we're looking at they're Hispanic women who typically work in a service economy, are no longer getting hours at the restaurant, no longer getting hours in whatever service industry they're working with. My still have jobs. You know, the adult men are still working. However, together, many of them are working in areas where they, they must continue to work, discussing a lot of the stress that we see. All right. And so, of course, there's a great need. As mentioned with that, many individuals have never in service, but come on, many of our clinicians have never participated in telehealth services, and everyone experiences it differently. And ultimately,
Excuse me, Michelle, you seem to be
there's
breaking up a
that
little bit.
because we're asking, when we ask somebody to sign up via telehealth. All right. Can you hear me okay now? Any better? Angel,
Yes,
can you hear me?
it seems to be better, yeah.
Okay, good. I have a mobile hotspot that if we need to, we can jump over. So, but I know there's no, should be good. Try this out. Okay. Great. And so just that last point. And so looking at trust in leadership, when we ask people to sign up via telehealth, we are asking them to trust us that we are using a connection that is stable, speaking of which, asking them to sign into something where it is confidential and that we are going to protect them. So one thing that I'd like to bring your attention to is way back, if you signed in, you know, right before noon, we had a slide. I loved that slide because it demonstrated exactly the good best practices in telehealth. And so when we're talking about, do you trust us, to be clear that we're going to record this session? When you're thinking about, okay, is my information being cataloged? Can other people see my information? Are they looking at me through that video? That first slide gave you all of that information right out, what's expected, what you're going to see. And so I think that's super important, that I really love that slide because of that. All right. And then, of course, cultural norms of coping during a crisis. So during a crisis, most individuals seek control and connection. Many individuals within the Latino population tend to value interdependence and community, and many use community supports to meet needs and find connection. And so here we're looking at, just to kind of put this all together, we have our pandemic, which sets our crisis. We're looking at the need for coping and the disparate impact of this pandemic on our population. And then we bring in a technology that is completely new to the majority of us. And so this is kind of our context of where we're providing services for our clients. So there's some best practices that we can use as we're going forward. One of the things that has really helped me in thinking about, because even, you know, once I get on this internet, I find often for myself, you know, remember, we are also in the middle of this crisis. It's that, okay, I don't have my typical things around me. I don't have my, you know, typical ways of connecting. And so I found, going back to some of the evidence-based practices that can really help me orient as to what is my goal here, especially as I'm sitting down with the client via telehealth and I'm assessing, what do we really need to talk about today? So the first thing that I like to bring in is psychological first aid. These principles have been very, very helpful to me and some of the individuals that I supervise to help ground us and start to clarify the beginning things so that we can move forward successfully. And so if you haven't had an introduction to this before, if you look up psychological first aid, Google it, you will find all sorts of information, evidence-based information that can help you with this. And so what I look at is first of all, the important thing is contact and engagement. Looking at, are we providing for the safety and comfort of our clients? As we talk about what they need, that's the first, Maslow's hierarchy of needs. Secondly, we look at stabilization. Do they need stabilization? Are there things that we can do for them to help them gain resources, whether it's food pantries or other services that they might need? We provide some information gathering on current needs and concerns. practical assistance, connection with social supports, information on coping, and then linkage with collaborative services. And so if you've worked with the Latino population for a while, as we can see, you know, there are many specific things that we can do, but grounding our telehealth session during this pandemic to looking at these principles and, okay, before we go, you know, before we start talking about maybe returning to a goal that we've been working on, you know, let me make sure you're doing okay. You know, let's talk about, do you have everything that you need? Are you able to, you know, just some of the needs, concerns you've had regarding this pandemic. And what that does, it sets the stage to be able to talk about what's going on, even though we're telehealth, but while also helping us become grounded and focused so we can make a decision of, okay, we're going to put this outside. We're going to put the pandemic outside our session today, you know, so that we can focus on whatever your goals are that you're working on. Or we can say, you know what, it really sounds like this is what you need to talk about. But it's just working to balance that. And I found this to be very, very helpful. All right, so providing services via telehealth. And you don't know, I'm looking at that picture and I've had that experience myself. I'm trying to provide an individual session and all of a sudden I have a kid wandering in, but talking to them. That's what that made me think of, although I'm sure it could be a, you know, a design where everyone is invited. All right, so first of all, consider, how do you like to communicate? Some people are very nonverbal, you know, in other words, you know, we're looking for the smiles, the eyebrows. We got 141 muscles in our face and all of the little things that we do. It's really fun research if you want to Google something. Again, if you're a little unfocused like me, all sorts of things, just a little bit of a tick in the nose and the eyebrow can mean a completely different thing if we're nonverbal. Some of us are contextual. We're looking for those things of how do you, what do you call me? You know, how do you approach me? How do you sit? How far away are you? And for many of us, that nonverbal communication, it is subtle. We don't point it out. You're sitting farther than you are. We don't point it out. But these are things that instantly we take in, and all of us do it differently. And so I think that's important to note, is that some individuals are culturally, they pay attention much more to the words that we're using, as opposed to other people are paying attention to the context. I had this interaction the other day, working with two individuals from different cultures. And the one who was a nurse actually had to address a doctor, just expressing some concerns. Now the nurse was, and I don't want to get too focused on those cultures, but the nurse was very deferential. You know, I think you're a great doctor. Everybody loves you. You know, this is something that, you know, I think you're great at. But I have some concerns about the medication you gave. Well, the doctor, who came from another culture, was actually very offended. She felt the approach of, well, you know, everyone loves you. You're a great doctor. I really, you know, value you. She felt it was sarcastic. And so knowing each of them and their different cultures, the one comes from a very deferential culture where, you know, that was an attempt to say, hey, I just want to put this forward as delicately as possible, and I don't want to offend you. And the other person took exactly the opposite, you know, but it was paying attention to those words, but it wasn't just words, because the words were fine, but it was the tone and how it was taken. And I'm sure their own context of their relationship, of how they'd interacted in the past. And so in thinking about this, these are things that I know many of us as clinicians that have been doing this in person for a while, we kind of stumble at, because we're like, as a clinician, we are taught, especially if you tend to be a little more gestalt and watching the individual, we tend to be very much looking at the whole person. And now we have to go into a media and a modality where it's much harder to see. You guys have no idea what I'm doing with my feet right now. And actually, because I use my hands, I'm trying to keep them down, you know, so I'm not so handy up here, you know, and that's part of my communication. But of course, with telehealth, it's a little bit different. So first of all, consider how you like to communicate and how the way you like to communicate may be perceived in telehealth. All right. So to back up, while you're thinking about that, I'll give you a little more information. Uses of telehealth during a crisis. Inpatient, we see large hospitals using it in the patient rooms. Outpatient, of course, we see, you know, therapy sessions. That is what I see the most common. Some crisis, we don't. The agencies that I've worked with, we see majority of the crisis workers still going out because of the nature of the crisis, and we'll talk about the appropriateness, but not always. you know, and then of course maintenance. And these are your clients that are coming in and returning just to continue to maintain whatever progress they've made. So cultural factors impacting services. The one things that we've seen in all of these types of services, we see that Latinos may be primarily connected to resources through schools and churches. So when we look at that maintenance care, you know, we have so many children and families that are served by their schools and churches that have no longer been connecting. Now we see as we move through this, and many of the states are being restored, we see this changing, but it's still different. I know there are many religious organizations that are now requiring registration, or you can only, so many people can enter. And if you are not, if you're a person that, you know, isn't paying attention, if you're not connected to social media, you're not connected to, you know, emails or the way that the schools or churches are connecting with people or sending out messages, that can be a continued and ongoing loss. The Latino population is a younger population, and so therefore may have more experience with technology from school. I've been blessed because many of the adolescents I work with are using school computers, and they've gotten permission from their schools to use it for medical appointments, which has been great. But without that, and it's problematic, certainly. And then service providers may struggle to connect and maintain contact due to clients due to lack of access or mistrust of technology. I know I've had at least one client ghost me in the last 3 months, and we were doing Zoom sessions and texting, and it's very easy to ghost your clinician. Not that it's hard when we're seeing each other in person, but it really was much more of a sense of, okay, I haven't actually physically seen this individual. And for me as a clinician, it caused me a little more pause than maybe if I had seen him in person. To date, no studies have found any patient subgroup that does not benefit or harm by mental health care provided via remote video conferencing. This includes individuals with psychosis. What they found with individuals with psychosis is typically they did not find that the delusions necessarily started including the telehealth sessions. It wasn't, you know, they didn't find that that was a typical issue that occurred, which, you know, I found was good. But so yes, so just about anybody can do it. I know I work with individuals who are even offering it to preschoolers, much shorter. And I've had feedback that they believe that the preschoolers think they're just a really good television show. But it is being offered, you know, pretty much to all populations at this point. However, providers should consider the patient's expectations and level of comfort to determine appropriateness. There are individuals that it will not be appropriate for. Of course, it may be okay for a population, but the individual may be different. So here's some things to take a look at as you're preparing for sessions or as you're providing them. I know some of us have been providing them already, and so in looking at this myself, I kind of had the opportunity to go back and go, am I doing this clearly? So first of all, provider and patient identity verification. If this is a long-term patient, great. You know, I've recently had to do some sessions with new people though, people that didn't know me, and also I've had to do them on the phone where I'm just listening to a voice, which was very, very awkward, and also a very big chance for wrong identity. You know, somebody's mother, cousin, whoever, you know, doing that phone call instead of the individual I actually needed. And so in those sessions, I had to be much more careful not to give information that might have previously, you know, we might have talked about freely, just looking at, you know, confidentiality. The provider and patient location documentation under the telehealth rules, we do have to document. Of course, that's true in an in-person session as well. I verify contact information and expectations. That verification of expectations, just as when you're running a group, verify, you know, make sure everyone knows the rules of the group. Same thing works with telehealth. I have an individual that's living in a hotel with their partner, and we have had to go over many times, nope, they can't be in the room. You either have to go outside or they, you know, vice versa. But, and at times I've had to halt the session. And experience people trying to pull a fast one on me of, oh yeah, they're out. And then all of a sudden, 10 minutes later, the person starts talking, and we have to talk about why. And here's some of my concerns, which I don't mind having a family session, which is sometimes what we turn it into. But it's that I may ask questions that at that point you don't feel comfortable answering, or you have to lie because your partner is sitting there. And what does that do for our clinical session and my understanding of the problem? You know, and so bringing those things up very honestly is important. So some considerations as you choose who's appropriate. their cognitive capacity, history regarding cooperativeness with treatment, current and past difficulties with substance abuse, history of violence or self-injurious behavior, ability to gain appropriate informed consent, potential for technical failure, and ability to ensure safety and support. Ultimately, if we're working with someone who is suicidal, doesn't have support, you don't have anyone that you can, okay, I'm going to call your mother, going to call your friend, that can be a huge, huge risk, especially if we have a session where a lot of things are brought up and we have no way to connect or reach out, and we don't have a solid place to connect with them. And so being able to assess this to ensure that you are able to make sure there's safety is very important. And also looking at cognitive capacity and cooperativeness with treatment. Many of my clients who I've had the experience of, those who maybe have not been as cooperative, actually have been more cooperative. And I think some of it is they don't have the excuse of I didn't have a ride. However, you know, sometimes that's not an excuse. Sometimes that is a true, it's hard for me to get to sessions. You know, it's hard for me, I don't have the car, or the person who's supposed to drive me didn't, you know, show up. And so in some ways telehealth can actually help with that. And so that can also be a consideration, especially as we move forward. I know many agencies as we go forward are looking at bringing this in as a permanent fixture, you know, of our clinical world. And so as we consider who would most benefit from this, these are also things to consider. I have some clients who I'm pretty sure that they'll continue with it as long as their insurance pays for the telehealth option, because it's proven to be very, very good for them. Other clients, we're looking forward to them coming back. So informed consent. So this is super important. So remember, earlier on, we talked about just our own familiarity with technology. And so this is something that you should know, is the service that I'm using HIPAA compliant? What are the requirements of the insurance companies that I'm charging, of course, if that's the world you're in case management worlds, also knowing, you know, what sort of consent do we need? Where is this information? Where are we going to use this information is really important. And so therefore, some of us, I know in my practice, we've had to adapt some of our form to be able to explain this is how we will use the electronic format. I know even discussing about recording. Is it allowed? Are you allowed to take a picture of me? You know, screenshot? No. You know, how do we go forward, and what is expected? And to say, I'm not going to record you. If, you know, if I were to record you accidentally, I will tell you, I will notify you. I ask that you don't do that, you don't record me. And also understanding how it will be documented, you know, and talking about, okay, if for some reason this doesn't work, you can't hear me, you can't see me, what are we going to do? You know, are we going to go to the phone call? Are we going to cancel the session? How will that work? And how can I reach out to you again? You know, and then lastly, I think it's important to note the conditions under which telehealth and telemental health services may be terminated. If this is if I see that you have other people, I've had people who, you know, keep looking up, and so I know there's somebody there, and it's okay if you keep bringing other people where I can't see them. It's just not being honest between us. If you want other people in your session, tell me, but otherwise, this is a reason I might, you know, say you have to come to the office. So, and then of course the physical environment. This looks so comfy, doesn't it? And so with the physical environment, it's making sure they're comfortable. Often I have had clients answer the phone in Menards, you know, I'm sitting here as a therapist doing this for many years going, well, of course you wouldn't have a session in Menards, you know. However, the client didn't know that and was surprised when I said I might ask some questions that might be private. And so spelling that out, even though this is an individual who had been in therapy for years, but spelling it out and explaining, hey, sit down in a comfy place where you feel comfortable talking about some uncomfortable issues or anything that you might want to bring up. You know, do they have to use a webcam? I worked with an adolescent who sometimes when they were feeling emotional would turn off the video. Am I going to make that an issue? With that particular individual, I said no. It was actually for him safe, where he could, you know, process his emotions. He didn't want me to look at him. But then we talked about, okay, let's turn it back on now and let's talk about what happened. And that was very helpful for him. But for other people, that might have been inappropriate, you know. And so, but it's working with that client. Considerations also in using telehealth. If the rapport has not been developed, an appropriate assessment of physical and mental health symptoms may be difficult if the client's entire body is not visible. We talked about me and my use of hands. And so if you don't know them and how they move, this is something where you have to now translate what normally is a visual, review to a verbal one. Frequently, I know in groups, we might have a physical exercise, where we talk about, okay, everybody stretch, okay, how does that feel? Okay, move in your seat, are you comfortable? We might do a mindfulness activity. Mindfulness activities work great, via telehealth, because we can sit, I can even put on a video or music that they can hear, and we can walk through that mindfulness activity, and they can tell me, okay, how do your feet feel? How do your shoulders feel? And it's a way for me to see what's going on with their body without actually being there in the room with them. And of course, as I've mentioned, our comfort level with technology can impact the success of the interaction as much as their comfort. If I'm sitting here and I'm getting flustered because, okay, it's not right, and my hair's a little goofy today, and every time I touch this side, wait, it feels like that side. If I'm getting flustered, that can impact the client. Just as if we were meeting in person and I'm feeling uncomfortable myself, the client is going to start thinking, what's wrong with me? What's going on? Is there something I said? And so sometimes that is where it's being vulnerable of, hey, you know what? I'm still figuring this out and I can't find the button and it just isn't working today. And that's okay, because we're all working through this together. All right. So some considerations in using telehealth in cross-cultural communication. One of the things that I always say is cross-cultural communication is actually with everybody. And so the second we start talking to someone, so earlier today I had the opportunity to meet with people who are from different parts in the country, which is fantastic. And instantly, and they're probably laughing right now behind the scenes, instantly we started assessing each other, because in telehealth, what do? We listen to language. Where's their accent from? How are they, once the video comes on, it's looking and going, okay, how do they behave? How do they speak? What are their mannerisms? And that's cross-cultural communication instantly. Now, these are individuals from the United States, but I can't assume anything about them, their background, where they came from, where they grew up. And so some of that is communicating and asking. And so in this, second we meet somebody, we start evaluating. Cognitive level, what level do they speak at? What kind of words do they speak? You guys have been doing this to me since I started this, of kind of getting a sense of me. Is she somebody I'd like to go to a drink with? No. Because we instantly start to go, okay, does she seem intelligent? And if we were actually talking together, you would adjust the way you talk based on how I talk, and I would do the same. That's cross-cultural communication. We adjust, even though you would probably talk differently to your 5-year-old niece, because you're again adjusting for their age, in that case. Someone that comes from a different race, somebody that comes from a different country than you're going to adjust based on how they're communicating. Are they more expressive? Like I said, love using my hands, or are they more closed off as they talk? Your energy, if you're really working to communicate well, is going to reflect what they do. And so one of the pioneers of looking at this was, of course, Gregory Bateson, who's looking at that meta communication. It's that outside, how are we communicating on a large, what exactly is going on in this larger feedback loop, and how are we impacting each other? This continues to happen within telehealth. And so as we're thinking about how we're going to communicate being conscious of cross-cultural communication, we're thinking about their language capacity and their ability to communicate verbally and non-verbally using telehealth. Like I mentioned, there's certain accents. So I grew up Chicagoland area, primarily Mexican population. And when I go to different countries, we might still be speaking Spanish, but especially like South America, the accents get me. It's much harder for me to do telehealth with someone from a South American country because the accent's different and you can never hear as well. And so instantly my capacity, even though, I can understand Mexican Spanish all day long, perfectly fine, but it becomes more difficult. Same thing with some English, some accents in English. I believe I speak English okay. But certain accents become much more difficult. And in normal in-person communication, we rely on the nonverbals, but that's hard to do via telehealth, So also consideration of their ethnicity, race, age, gender, sexual orientation, geographical location, etc. Need to be understood regarding how they use technology. And then vulnerabilities, vulnerable populations may not have technological capacities to connect, or maybe using the technology of a friend, which is important to think about. And so within this cultural communication comes the idea of how do people express stress? And that's my question. When we think about how do you express pain? When you're hurting, what do? How do other people know? Do you verbalize, man, I'm feeling sick today? Do you kind of suck it up, and just, maybe people can tell there's pain on your face. You didn't, sleep well. Maybe you don't tell anyone ever. And so looking at this is also a cross-cultural communication here. So the concept of distress, cultural concepts around the expression of distress may be related to acculturation, discrimination, oppression, and the stigma related to physical and mental illness. I don't know if any of you have coughed in public recently, but it is a horrific experience. Instantly, perfect. Yeah, sorry about that. All right, and so looking at cultural idioms are a way that people from different cultures express. They use expressions that are consistent with the culture-bound syndromes that they experience. For instance, some individuals may report body sensations and feelings rather than mental health symptoms. And as we've discussed in a telehealth modality, it may be difficult for someone to actually see that, and this is where a lot of that asking the individual how they're doing and where they're feeling this. And especially with COVID-19, this may impact the individual in multiple areas of their life. Many mental health symptoms that are present within the body can also be attributed to COVID-19. Experiences of depression, anxiety often are felt somatically, or in other words, you're feeling depressed and it's defined as, well, I just have a stomach ache, or I've had a headache all this week. And often it's linking us to greater mental health symptoms that need to be assessed. The ongoing crisis may cause individuals to experience multiple varied symptoms that come and go. I know for a while during the crisis myself, I would get a stomach ache and a headache every Friday night and Sunday evening. I was convinced I had COVID. Of course, I didn't. But it was that, okay, this is stressful, and how do I process those emotions that are going on? And then, of course, individuals with different levels of acculturation may have multiple models of distress and help seeking, and so asking people, and I love using the cultural formulation interview and using that as a basis. It has some wonderful questions. It's at the back of your DSM-5. And so it has some wonderful questions that are very appropriate, that ask about the problem and previous help seeking behavior that can really help our assessments be appropriate and accurate and consider just some of the cultural needs that the individuals may have regarding COVID-19 or regarding their own mental health. Some challenges in assessment, of course, when we are assessing any culture-bound syndromes and cultural idioms, there needs to be an assessment of cultural factors that affect self-coping and past help-seeking behavior. And that comes, like I mentioned, from the DSM-5 and the cultural formulation interview. Many cultural idioms are expressed through those physical symptoms, and like I mentioned, it's very hard to assess those. Of course, as we've mentioned, many clients are unfamiliar with telehealth and might not be as open, especially if I have a friend here that's listening on the other side of the door to my symptoms or what I'm talking about. It's very difficult to share, and especially many of our clients are living in places where they might not have a lot of space, or their own mental health services may not be respected and recognized as, okay, they need private time. And other times, what I've found telehealth to be great at is often it's easy to include a family member. Hey, can you go get your mom? Or hey, you were talking about this, maybe we should bring your husband in today and have that conversation. And we can decide whether we want to do that now or not. Of course, we have to recognize the retraumatization. COVID-19 may re-traumatize individuals that have previously experienced food insecurity, lack of safety, and separation from family members. I mentioned working with many of my adolescents who, because of immigration issues, have had significant fears regarding losing family members, and now are fearful every time their parents go to work that they may get sick and die. Even though there's a lot of statistics stating that people recover from COVID-19, the information literacy of our clients may not be great, you know, and so part of our job is to help them through that and help them identify where they can get reliable information. And then assessment of trauma as it impacts the individual requires that empathy and understanding of their narrative. With COVID-19, as with any large crisis, people begin to develop a narrative of how this affects them. And especially when we're working with individuals in crisis, working with individuals via telehealth, as we move through this and as we start to reintegrate, helping them develop a helpful narrative about what does this mean? You know, this is painful. Why am I going through this? Why does this happen to me? You know, is there a benefit to this? Helping them with that language to re-narrate what is happening can help them move through successfully and help through that traumatic process, you know, so that, because this is something that we will be dealing with psychologically for many years, you know, as we continue on. All right, so effectively communicating while using telehealth modalities. Here we go. So considerations in high context cultures. So I mentioned this a little bit ago. So there's, you know, so Halverson wrote about there's high context cultures and low context cultures. The Latino population tends to be a higher context communicator, tends to be higher context communicators than individuals from the white, you know, United States population, the general population. Now, when we look at what that means that they're looking, kind of like I mentioned before, at everything that's going on, you know, much more. So, you know, white America in the United States tends to look very much with our words. We tend to be very semantic. And we paid very, very close attention to what words were chosen, how they were said. Well, I shouldn't say how they were said, but which ones we chose, and even what we meant by those. Versus other populations look at the context. What was the situation? You know, how was it said? And then who said it as well. And so here's some things to think about just in terms of how that may affect telehealth. Also to note, learning often occurs by observing others as they model or demonstrate. And so that's where we, you know, and I think I've emphasized this throughout this webinar today, what we do on a regular basis is extremely important. You know, if we are not paying attention, if every once in a while I get distracted looking at my phone, or, you know, start dazing off, you know, or looking above me out the window or something like that, that's role modeling. And we're teaching our client just how to use this modality, as opposed to, you know, being attentive and paying attention and showing them what is expected and holding them to those expectations that we talked about to begin in the beginning. Using them, we can use telehealth to provide ongoing support and community, and especially we can also use it to model positive boundaries. I know all of a sudden what's interesting about telehealth is now many of us are in our homes, you know, and so frequently, you know, previously many of you would have said, I'd never see a client in my home. Well, now you are. And you're seeing them in their home, for those of you that don't want to do you know, home visits. And there's a different way of acting, you know, as a clinician. Do I have to get dressed up as I normally do? Or for the client, do I have to get dressed, you know, do I have to do my hair, things like that? And then how do I behave? If I feel like going to the bathroom, can I just go? Well, this is my house. You know, can I eat a snack while I'm in session? And so we have to model those positive boundaries, which can be very defining for a therapeutic relationship, especially if the client agrees to respect our boundaries or not, you know, and that can be good therapeutic material for us to talk about and work through and discuss, you know, what's going on with there and how might that affect their presentation in life. And so designing effective interventions, we have to meet the client where they are, eliminate the major barriers, enhance the self-reflection of the experience, be able to talk about it, just like I've been doing today. It's like, okay, we're on a webinar. This is, you know, we are subject to the whims of the internet world. And it's okay. We're all in this together. And then use that interactive communication loop. What an interactive communication loop is so I just said this, what did you understand by it? You know, when I said that, how did that make you feel? Can you tell me more about that? And especially getting that extra clarification that we might not normally get in person, because we can see much more of the understanding, but it's that asking them to, can you rephrase? I just want to make sure that what I said was understandable, you know, and that's super important with telehealth. Giving them choice. Crisis leads us to not having a lot of choice. Do you want to meet via Zoom, or do you want to meet in some other way if I can do it? Today, is there something that, you know, you're sitting at home, is there something you'd like to show me, you know, just that something that's meaningful to you, and we can talk about that. Giving them choice as much as you can, both that's good practice during a crisis, but also with a new modality, helping them help you problem solve challenges. Okay, you don't have the internet, or your sister took the computer today. How can we work through this? How do we want to handle this? What do you prefer? Identify and address implicit bias that could hinder patient-provider interactions and communication. I have found I have so much bias regarding technology and who I think has it and who doesn't. That has struck me, you know, because no, I've never seen, you know, some of these things I just don't ask because I have bias. And so making sure you're looking at your own bias of what they can do. You know, when something breaks, well, can you just call me? Well, no, I don't have a phone. You know, I borrowed the computer from my sister. I didn't borrow her phone at the same time, you know, and thinking about this. Discuss previous experiences with therapy and technology that have been effective. Have you ever done this before? What's worked for you? Okay, have you ever done this with friends? What works for you then, you know? And taking some of those little things that have worked for them before and using it in this modality. And then consider individual and environmental factors like the internet that might impact these services. Of course, at the end, then we must evaluate, maintain ongoing communication with the clients about expectations of the service, focus on the client's desired outcome, process the feelings about this, and increase the empowerment through providing choice. You know, that is really going to help the client become much more comfortable with this, where, you know, this is just a different modality. I'm the same person, you're the same person, we're still working together collaboratively, you know, to achieve our goals. So in the end, I've gone through a lot, you know, regarding telehealth. I'll throw in a couple other things that sometimes people like to see. In looking at activities and things like that, I usually get questions about that. What I found, some of the individuals that have been doing this a long time are the education people. About 5 years ago, there was a just big burst of teaching online. And I have stolen from quite a few of the online educators, you know, both K through 12 and higher education, as to how they best provide these online services, activities, things that they can do to engage people. I found that particularly helpful. I use a lot of videos myself, YouTube, things like that, to engage individuals. And also I help them use their environment. In other words, is there something here, you know, is there something that you like that you can tell me about? And again, using family members. And so this is a modality that can be very, very helpful when it's used well. And so with that, I will open up for questions and answers.
Unfortunately, due to our technical issues, we do not have the time to go into the question and answer portion of the session, but please note that we are working on a fact document to send out after this presentation. So feel free to send your questions to the Q&A, and we will get to them in that document, and make sure Michelle is able to see them and answer them effectively. We'll be sending out in the next couple of days the access to the document, also with the other information from this presentation. One quick note before leaving you all: thank you for being here. Make sure to fill out the survey. You have it through the QR code or through the link. You can also access it once you close this window. Once again, we'll be following up. You can also follow it through our page and our contact information that is in the next slide. Also, we have our 4th session in Clinical Innovations Telehealth Learning Series next Tuesday at the same time. Make sure to sign in and register for that one too. This is our contact information. Thank you guys for being with us today. Hope we'll see you next week.
Thanks, Michelle.
Thank you.
Thank you.